Hi, everyone. Welcome to our webinar. I'm Shane Brady. I'm the Deputy State Epidemiologist here at the Arizona Department of Health Services. Appears we've reached our capacity right now, so we'll go ahead and get started. So we're going to talk today about our Arizona COVID-19 response. So we're going to review the outbreak to date and the response in Arizona, how you can prepare, what you can do, and any questions you have. So we do ask that you write your questions in the chat box, and we'll try to address as many questions as we can at the end of the webinar. So we're going to go ahead and get started and give an outline of the outbreak. So in December, several local health facilities reported clusters of patients with pneumonia of an unknown cause that were epidemiologically linked to a seafood and wet animal wholesale market in Wuhan, China. Initial reports suggested animal-to-person spread. With a growing number of patients without exposure to animal markets, person-to-person spread was suspected. In January, the cause was identified as a new coronavirus. By the end of January, there were over 9,000 cases globally. Airport screening was initiated in the U.S., and the first case of novel coronavirus was detected in the U.S. on January 21st in Washington State. And Arizona confirmed the first case on January 26th. In February, the WHO officially named the disease COVID-19, and by the end of February, there were 51 countries with cases and over 80,000 cases identified. The U.S. had their first possible community spread of COVID-19. So as of March 11th, the WHO declared a pandemic. There was over 110,000 cases around the world and at least 114 countries affected. So in Arizona, as I mentioned previously, we had our first case identified in January. And then in February, we had all close contacts of the confirmed case that tested negative, and our case eventually tested negative and was released from isolation. As of March, Arizona reported more cases. We've had travel associated, no known exposures, and as of the 11th, we had 9 cases in Arizona, with 938 in the U.S., excluding the cruise ships, and the governor declared a state of emergency. So as you can see from this map, this has rapidly expanded from China. The WHO, again, has been putting out daily updates and the situational reports for you to find out the most latest information of what's going on around the world. So what do we know about the virus that causes COVID-19? Well, we know it's a novel coronavirus and it's called SARS-CoV-2. We know coronaviruses are a large family of viruses. There are several known coronaviruses that infect people and usually only cause mild respiratory disease, such as the common cold. And coronaviruses can be found in animals, and some of these viruses have the capability of transmitting between animals and humans or from person to person. So what do we know about COVID-19? Well, there's a wide range of symptoms from very mild to severe. Symptoms can include fever, cough, and difficulty breathing. And on a note, this really does look similar to many other viral respiratory illnesses, such as influenza. Information so far suggests that most COVID-19 illness is mild. A report from China suggests serious illness occurs in about 16% of cases. Of importance is that we know that older people and people with underlying health conditions like heart disease, lung disease, and diabetes are at higher risk for severe outcomes from COVID-19. And it increases with age over 60. So as people get older, over 60, the risk for severe outcomes does increase. The virus is thought to spread person to person via respiratory droplets that are produced when someone infected with the virus coughs or sneezes. And symptoms typically appear about 2 to 14 days after exposure, and again are similar to flu. There's currently no available medication to treat or vaccine to prevent, although there are a number of scientists working on both of these. However, we can all take everyday measures right now, including proper hand washing, covering our coughs and sneezes, and importantly, staying home when we're sick. So we want to talk about the public health strategy when we have these emerging pathogens. So initially when we have an emerging pathogen, we're often trying to contain these things at the source. And then as things progress, we move towards community mitigation and preparedness. So in the early stages of an outbreak like COVID-19, public health takes measures to contain the disease and stop it from spreading in our communities. So for example, in Arizona, our local public health partners were monitoring travelers from affected areas and making sure that individuals suspected of being infected are isolated until their test results came back negative. Given what's going around the country and in Arizona, it's clear that there's a higher likelihood of community spread. We do have community spread in Arizona, and we really want to make sure that these public health measures are really shifting now to slowing the spread of the virus rather than containing at its source. As we identify additional community cases, it may be not feasible anymore to really isolate all infected individuals and quarantine their contacts. And instead, we are going to be shifting more towards community business leaders to encourage social distancing. And again, we're really encouraging everyone to stay at home when they are sick. So what can you do to prepare your faith-based or social service organization? So we want you to review your policies and protocols and stay informed about COVID-19 in your community using reputable sources. Develop and review your emergency response plans. Distribute health messages and materials about everyday preventative actions that include respiratory etiquette and hand hygiene. And plan for what to do in the event that public health recommends canceling events or services. We want to ensure that response plans are flexible and account for potential increases in absences due to illness in staff and their families. And identify activities, rituals, and traditions that may need to be temporarily suspended or modified. And we want to assess the risks of attending gatherings for those at the highest risk for medical complications. So again, those are over 60 individuals and individuals with chronic medical conditions. We want to ensure that we're routinely cleaning and disinfecting surfaces and objects that are touched frequently, including tables, countertops, doorknobs, telephones, railing, toys, etc. And using a bleach and water solution or disinfectant with a label that says EPA approved for killing bacteria and viruses, and always ensuring that we're following the directions on the product labels. And organizations may need to postpone or cancel international travel that could expose staff and members to potential community spread of COVID-19. And really, leadership is encouraged to consult with local public health officials in making such decisions. And the CDC has a nice travel notice webpage that kind of goes over where there's widespread, sustained community transmission around the world. So what can you do to prepare your members and staff? CDC does not recommend that the general public wears face masks to protect themselves from respiratory diseases, including COVID-19. However, we do want to make sure that there are supplies such as tissues and hand sanitizer well maintained and placed in multiple locations for ease of access. We want to educate about the everyday preventative actions that we can all take, such as staying home when sick, covering coughs and sneezes with tissue or elbow and throwing the tissue away, washing your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based sanitizer that contains at least 60% alcohol. And we want to encourage staff and members to get the seasonal influenza vaccine. We also encourage placing posters that encourage members and staff to stay at home when sick, practice this respiratory etiquette and hand hygiene in visible areas such as the entrance of your facility or other common areas. So we have some additional resources posted, including getting community and faith-based organizations ready for coronavirus disease. We have our coronavirus webpage at ADHS with the faith-based section. There's also the CDC pan flu guidance for community and faith-based organizations. We have the travel guidance I mentioned previously, and then interim guidance for businesses and employers to plan and respond to COVID-19, as well well as resources for households and the EPA-approved disinfectants list. So if you have any questions about how to prepare for COVID-19, we do recommend you talk to your local health department. Again, please access these resources. They do have a lot of the information that you may have questions about. And at this point, we'd like to take questions. So again, please just type your questions in the chat box and we'll do our best to address as many questions as possible. So I'll start off with some of the questions we actually received prior to the presentation to discuss. So one of the questions was about the impact for transmission vulnerability as well as death rates on babies and pregnant women. So limited reports on China on children describe mostly cold-like symptoms such as fever, runny nose, and cough. And they suggest that children with confirmed COVID-19 may really present with mild symptoms. And although there have been severe complications reported, they are uncommon in children. For pregnant women, we really don't know at this time whether they have a greater chance of getting sick from COVID-19 or whether they are more likely to have serious illness as a result. We do know that pregnant women do experience changes in their bodies that put them at increased risk for some infections. And with viruses in the same family as COVID-19 and other respiratory viral infections such as influenza, women do have a higher risk of developing serious illness. So it is important for pregnant women to protect themselves from these illnesses. So avoiding people who are sick, washing their hands often, some of the same preventative measures we mentioned earlier. So there's also questions on is there any email listservs to subscribe to and what qualifies as mass gathering. So the one listserv you could subscribe to, we do have our public health releases online and you can subscribe to those. Again, at azdhs.gov, and if you go to the bottom, there's an email icon you can choose and you can select to subscribe to specific reports. So you can subscribe to those media briefings that come out. And then in regards to mass gatherings and communications around that, that will be done at the local level. At this time, there's no official recommendations to cancel specific events. And this is an evolving situation and that could change. But we definitely want people to consider those things and for your organization, your population, and consider whether cancellation is a good idea or not. We also have a question about precautions to use in a setting that's not strictly medical setting, but has some medical support. Again, we recommend the same preventative cautions, avoiding people who are sick, staying home when you're sick, washing hands frequently. And for those medical providers who are providing care to sick individuals with respiratory illness, including COVID-19, they really should be using gloves, gowns, surgical masks, basically droplet precautions with eye protection, so goggles or face shields. And if they are doing any aerosolizing procedures, to also have N95 masks in an airborne isolation room. So there's a question about what kind of animals do we have to worry about, connection with animals here. At this time, I do not believe there's been any transmission from pets, for example, to people. Believe the source of the virus, they believe it's bats, but again, it's an evolving situation. The thing we're most concerned about is really transmission from people to other people. So again, if you are sick, stay at home, wash your hands frequently, and avoid sick individuals. There's questions about protective measures for employees who call off work and employees getting accounted against them in their annual reviews. We're recommending that employers be flexible because we really don't want sick people coming to work. So our recommendation is we need to be flexible in this situation and allow people to stay at home when they are sick so they're not spreading any diseases to each other. There's another question about whether the body builds immunity to this and if it's kind of more long-lasting or not, and whether it will resurface again. At this time, we don't know if there's long-lasting immunity built for this, but it is an evolving situation, and hopefully some research studies will show us the answer to that in time. So there's a question about whether previous illness, such as something like valley fever, puts people in the at-risk population. You know, I would talk to your healthcare provider about any specific questions, whether you might fit into one of these risk categories. They would be your best resource to kind of walk you through that and give you kind of those specific recommendations. There's questions about where to get sanitizer if you can't find it. We heard that there have been shortages of hand sanitizer. We know this is an ongoing issue, but you know, talk to your vendors, see if there's other ways to get it. The other consideration is really pushing people to frequently wash their hands and disinfecting those high-touch surfaces. So, you know, most places should have the availability of water and soap. So that doing that for 20 seconds is an effective measure to preventing this and other respiratory diseases. We do have materials on our website that can be printed off and displayed, and we'll make sure to send those links out. And I don't know if you want to pull that up for some of the materials we have. So we do have contact info for our local health departments posted on our website, and it's on the link, as well as Arizona COVID hotline, which we can post that number to all participants in the WebEx chat. So there's questions about testing availability. So again, we recommend that if you do have symptoms compatible with COVID-19, so fever, cough, shortness of breath, again, talk to your healthcare provider, call them ahead of time, and ask them about what your next steps are. Really, our healthcare providers are the ones that should be able to order these tests. There are commercial laboratory testing available from a number of commercial laboratories in Arizona. And for special situations, we do test at the Arizona State Public Health Laboratory, but that is coordinated through the local health department through providers. And these slides in the webinar will be posted to include some of the, I think some of these questions about some of the slides being posted. And we can put some of the resources in the chat box before we close out the webinar so that we can make sure you all have access to it now. But again, azdhs.gov/COVID-19 will be your resource, and you can navigate there. You can see on the front page our case counts, how many people we've tested at our state public health laboratory, and then there is a community section with faith-based and social services tab that can be clicked with some specific resources for faith-based organizations.
There's a question here on limiting coffee, food, or other distributions. And again, I would think about those kinds of things as the potential to put people, congregants, in closer contact with each other and increase opportunities for the potential for disease transmission. So as you're thinking about ways that you can limit those that potential within your communities, I would consider limiting those types of distributions.
I think another important component is on our main webpage, it does have some of our public health recommendations on the sidebar about, for example, whether we're recommending to cancel mass gatherings, which we have no recommendations at this time, no recommendations to close schools. But again, we are encouraging some of these other things like teleworking and alternatives for businesses. But if you do check that website regularly, you can see if some of those recommendations have changed.
There's a question about whether you should stay home if family members in the house are sick, but you are not exhibiting symptoms. So we know that the highest likelihood of transmission of COVID-19 is when people are acutely ill, when they have symptoms, when they have fever and cough. So if you've been exposed to someone with fever and cough but have not developed symptoms yet, there's a lower likelihood of you spreading the disease, but it still may be possible. So again, that's why the social distancing recommendations are for the population in general, and then specifically more intense for those patients with symptoms, those people with symptoms.
There's a question about an organization that runs a shelter and what they should do. So the CDC does have a great resource for shelters in terms of preparedness and kind of what activities can be taken ahead of time and when there are sick individuals in the facility. And we can go ahead and share that link as well.
There's a question about what would emergency preparedness look like for a church. Again, so the kind of emergency preparedness we're talking right now would be preparedness to face an infection, a publicly transmitted infection like what we're dealing with now. So again, those would go to the same things that we're recommending. So social distancing, how to keep people healthy and reduce the potential for transmission. So those are the kinds of planning that we're asking people to think about now and for future infections.
So there's a question about whether services, how that will be communicated if we do recommend canceling kind of mass gatherings and services. I imagine we'd probably send that out via multiple ways, including probably a media briefing or statement, as well as probably through different organizations, just like how we tried to reach out to everyone through this webinar. There's a question about, will warmer weather affect the spread? We don't know that at this time. We do know that some other respiratory viruses do decrease with warm weather, but you know, there might be some circulation. We just don't know what it's going to look like at this point.
There's a number of questions about thresholds for canceling services and whether or not the Department of Health Services will recommend canceling services. So again, those are decisions that are often made at a more local level and may be made in consultation with your local public health department or county public health department. The thresholds will be different for different communities and depending on how much illness is circulating in your community. So again, I would kind of consider those things both within your organization, and then if you have further questions, reaching out to those local county health partners.
There's a question about how far we should take social distancing measures at this time. Again, I think we're most concerned about the people at highest risk for COVID-19, people over 60 and people with serious medical conditions, so both heart disease, diabetes, lung disease. And really, for those individuals, we're really encouraging for those individuals to have supplies on hand, such as extra prescription medications, over-the-counter medications, supplies like tissues and other household items and groceries. And again, taking those everyday precautions, avoiding people who are sick, washing hands often, and cleaning, disinfecting those high-touch areas, staying away from crowds, and having plans what to do when they're sick and to call their healthcare provider. So we really want to make sure that those individuals who are at highest risk are taking those measures, and everyone in the community needs to take those everyday preventative measures, especially staying home when you're sick and washing your hands frequently.
There's a question about school closures. So school closures, like closures of any other faith-based meetings or groups or houses of worship, are really made by the individual organization, again, in consultation with their local county health department. So we don't anticipate from the state mandating closure of these, of either schools or houses of worship. However, those may be decisions that are made at a local level. It's a question about cleaning solutions to be used, and we have a link on our website of a list of EPA-approved solutions. That is a very long list, and I would say that many of the solutions that are already being used out there probably are on that list. You can kill this this virus with just bleach and water, simple solution, and those mixture directions are also listed on our website, so I would direct you there for more information. But reassure you that, again, most standard cleaners will suffice in cleaning for COVID-19.
So there's a question on how long does the virus last if contracted. So just to kind of give our recommendations around that. So if we do have people who are sick and tested positive for COVID-19, we are asking them to stay at home for the 7 days that since their specimen was collected, or 72 hours after symptoms such as fever, cough have resolved, and whichever one is longer. And so anyone who has fever and say shortness of breath, we want to make sure that those individuals are staying home for 72 hours after their symptoms resolve.
There's a question about children with asthma. So again, I would refer to the fact that we know that this infection is worse for those patients with underlying health conditions. In general, children are less affected than the elderly. But I would say for anyone who has an underlying health condition, particularly a respiratory condition, that they take the recommendations for social distancing especially seriously. And if you have any particular questions regarding any underlying health condition, that you refer to your regular doctor with those questions.
So there's questions about can the virus exist in standing water? So at this point, there's no evidence that spreads through other kind of water sources such as pools or like hot tubs. CDC is reviewing kind of what the data on transmission looks like from other standing water sources, but we don't have much information about that at this time. So questions, if we don't address your questions here, we do have on our website a form that can be filled out.
Again, there's a lot of questions coming up, and I understand about thresholds, both in terms of size of a gathering, relating to is there a cutoff? And we do not currently have a cutoff for the size of the event in order that it be canceled. So again, I would just refer you to, if you have those specific questions, your local health department might have clearer guidance as they kind of understand the nature of your community a little better than we do from a state level.
There's questions about sources of information and kind of how to balance it. And I think going to, your local health department resources as well as the Arizona Department of Health Services website will provide you really the community-specific recommendations and updates in Arizona and in your community.
And then if I can make one more comment about the decision to cancel services, I think it's really important to take those cues from your own community. So if you have a community that skews towards the elderly and those over the age of 60, and there's a lot of concern in your community about that, I think you have the potential to be a good source of information for those people, that social distancing and keeping yourself kind of removed from larger gatherings is a good way to decrease the risk for those people. So I think if you offer that information and then you see that people are not showing up for events, I think that may be another threshold that it might be a good idea to cancel services for a period of time until we have more information.
There's questions that it's advised to ask our elderly, those over 60, to not come to services. And again, I think Nick kind of touched on that point. I think considering what your community's feeling about this, and I think considering your population, it might be advisable to consider asking individuals who are at higher risk, just giving them that education that they may be at higher risk and that they may have serious outcomes due to this disease, and it may be advisable for them to really do social distancing, including not attending services in other concrete settings.
There's a question about how to dispel fear within office members and staff members at your organizations. So I think the best thing to do is just find a very good source of information. So we consider both our website as Arizona Department of Health Services and the CDC website to be good sources to refer people to. And again, try to just dispel some of the fear that's out there. If you follow proper social distancing practices and hygiene practices, you should be able to reduce your risk of transmission.
There's a question on where cases are located in Arizona. So at this time, there's cases in Maricopa, Pinal, and Pima counties. That website, azdhs.gov /COVID-19, is updated during the business week at 9 a.m. with our up-to-date case counts and with a map that shows the location of the counties that are affected.
Another recommendation, I had more questions about thresholds for canceling large events. Another recommendation I would make is to look at your local community and see what other organizations are choosing to do. I think in the past week we've seen a move towards, obviously, towards canceling more events. So I would just recommend that you kind of look at what your community is doing, how they are responding, and use that as part of your decision. There's a question about what you should expect in terms of quarantine protocols. So as Shane described, we're moving from a containment phase to a mitigation phase, and as part of that move, as we expect to see more transmission of this virus within the community at large, there will not be as much talk about isolation and quarantine. What we're going to ask people to do is, if you are sick, that you stay home. If you test positive, as Shane said, that there are kind of clear guidelines for those who test positive to stay home for that 7-day period or 72 hours after your symptoms improve. But there will not be the same focus on quarantine and isolation that you have seen in the past couple of weeks when we were in that containment phase. There's a question about what if someone has a cough but no fever or shortness of breath. We know from a lot of data from China that there are a number of very mild or nearly asymptomatic cases of COVID-19. So it's very possible that someone only has mild symptoms. Again, that makes this a little hard. We don't know if those milder cases are less likely to transmit the virus to other people. But again, any symptoms of cough, shortness of breath, that's why we're advising hand hygiene, covering your cough, all those kind of routine recommendations that should help those who have milder symptoms keep from spreading the infection in their communities.
So there's questions on the projection of disease. You know, we know now that there has been community spread of COVID-19 in Arizona, and we are expecting more cases. It's impossible to predict how many cases we have, but we do know this does spread like other respiratory viruses.
There's a question about whether you'll see the same information on local and county health department websites as on the state website. Because we are, the way our state government is set up, the state and local government is set up, we make recommendations to our local and county health partners, and then they decide what is best for their local areas. So there may be small differences between what the local public health department recommends and what we recommend at the state. That's okay, and we encourage you to look to your local health department as those recommendations often reflect particularities or specific things about your local community. There's a question about whether people can be contagious before exhibiting symptoms. That is something that is actively being investigated as we're learning more about this infection. Currently, we believe that patients are most infectious when they're exhibiting those symptoms. So a lot of our interventions are focused on controlling people who are symptomatic. We will know more in time about how infectious asymptomatic people are, but we do not know that right now.
And we are trying to share as many resources as possible through the chat. So if you check the chat, we are sharing some of the resources that were requested previous.
There's questions about, are there tests accessible to the community to test for COVID-19? So currently we have testing capability here at the State Public Health Lab that is limited to those patients who are sickest or those patients who have some public health action that we can follow through with. But we have a number of commercial laboratories that are coming online with much greater capacity for testing, that have many more tests available. Those tests are available through community providers, urgent cares, emergency rooms, hospitals. So we encourage you that if you are symptomatic, so if you have fever, cough, congestion, those symptoms that are consistent with COVID-19, that you reach out to your provider to ask about testing. And the test can only be provided through a provider at this time.
So there's a question about international travel and people who've been traveling in the last 2 weeks. So our recommendation is that individuals, if they're asymptomatic, that they be allowed to work. If they become sick, they should stay at home.
There's a question just to help better define what I mean when I say local public health. So yes, local public health could be your county public health, but here in Arizona, we also have tribal jurisdictions and other non-county public health entities. So that's why we refer to them as local public health. But yes, that can be county health in some areas.
There's a question on whether it would be beneficial to host services outside. You know, services outside, there may be some benefits to it just because of the airflow. So yeah, there might be some benefits to doing things outdoors versus indoors. All right, I think we're gonna go ahead and end it now at this point. We appreciate everyone for attending. We'll try to put some of these resources in the chat box before we close it out. Thank you all for attending, and again, we'll post these slides and webinar hopefully by the end of next week.
And we'll get that website up for our website here into the chat box so you all know where to go. Thank you.